The FUPA print go crazy. The FUPA print go crazy. Come on.
Yeah, FUPA print goes crazy. But is your FUPA print breaking your back? So we can only answer that question by breaking it all the way down. What is a FUPA? Or a FUDA? Let's not forget, some of y'all men have a FUDA as well. And the FUDA is FUDAing. If you've been living under a rock, then no, you don't know what FUPA is. But if you haven't, then you know that FUPA is an acronym that stands for Fatty Upper Area. Can I curse? I don't know if I can curse. You fill in the blank. The P and the D. Anatomically, that isn't really a term that we learn in medical school or residency. So surgeons like myself know that a FUPA really encompasses two parts. The first part is the mons pubis, and the second part is the inferior abdomen. Now, most women of childbearing age will have, to varying degrees, a pooch. And again, some men do too. The bigger the pooch, the bigger the FUPA. And some of y'all have what we used to call back in the day, maybe we still do, I don't want to age myself, the Dunlap, where the belly Dunlapped the belt, right? That is officially called a pannus, an abdominal pannus, meaning that you have an apron of skin that hangs over, and the pannus, again, there are levels to this. It can be big or small. So now that we've defined everything, let's ask the question again. Ask. Now that we've defined everything, let's ask the question again. Is the FUPA breaking your back? Well, we still gotta break it down a little bit. Because what we know is that back strength and core strength go hand in hand. The stronger your core, the better your back will be. The less pain you'll have, the less strain you'll have. If your core strength is disrupted, and it can be disrupted in two ways. So one is that you have this additional weight in the front that causes your body weight to shift forward, therefore putting strain on your back. The other reason, or the other way that your core strength will be disrupted is the more fat that we have on board, and pregnant women have this too, we have increasing space between our rectus muscles. The rectus muscles are the two muscles, long muscles in the front of your belly. And again, as we gain weight, the space between those two rectus muscles goes from this to something like this. And the more space that we have there, the less core strength we actually are able to have. And what does that mean? Again, back strain and back pain. So combine rectus diastasis, as we call it officially, the space in between the two muscles, and the asymmetric distribution of weight with a big FUPA print, and you could be having some back pain. So now that we know what a FUPA is and that it can break your back, what's the solution? What's the remedy? What's the answer? Unfortunately, it's just not that simple. So if I said eating right and losing weight, I would myself roll my eyes. Because while that is great and it's true, eating healthily and being active in fitness are never bad ideas. They're always good. They confer so many health benefits. But if you've lived long enough, you know that that doesn't always mean that your body transforms the way that you want it to. It doesn't mean that you get the six-pack. It doesn't mean everything bling, blang, blow falls into the right places. Sometimes it means you lose things you didn't want to lose. And sometimes it means you still have things that you thought would be gone. So eating right and being healthy, unfortunately, is just not enough. And that's why I'm here. No, but seriously, if you've gotten to that point, or your friend has gotten to that point where you have an abdominal pannus, that's very hard to lose. And the reason why is because you not only have excess subcutaneous fat or fat underneath the skin, but you also have excess skin. And so if you keep losing weight, you keep losing fat, if you do it slowly enough, sometimes, and you have good skin, I should say, that skin will retract as you lose the weight. But the way that we're losing weight these days is sometimes a little faster than our body can accommodate. With Ozempic, gastric bypass, gastric sleeve, we're seeing massive weight loss in a short amount of time, which is awesome. But it also means you're left with that extra skin. So what do you do about that? Well, surgery. Surgery to remove the excess skin. And that will get rid of the FUPA, the pannus. The additional step that might also maximize your chances of having improved back pain is bringing those muscles back together in the middle. What is that surgery? So if we just remove the pannus, it's a panniculectomy. If we remove the excess skin and we also bring those muscles back together, or plicate the rectus, as we call it, that's officially a tummy tuck or an abdominoplasty. But how about insurance? Does insurance cover that? The answer is it's just complicated. It's complicated. It's like your Facebook status. It's complicated. So insurance will usually cover a panniculectomy. Again, that's removing the abdominal pannus when it causes functional disturbances. So if it impedes your ability to walk, run, exercise, work, because you have to move around for work, then that is typically considered something that insurance will pay for. You have to check with your own insurance to make sure, but typically that's true. An abdominoplasty, a tummy tuck, is usually cosmetic in nature, meaning you pay for that. There have been exceptions to the rule. And so for the exceptions to the rule, I simply ask that you speak to your insurance company and your plastic surgeon to figure out if you are the exception to the rule. I've had patients who've been able to get it covered, but again, did a lot of work to prove that it was a functional issue and the only remedy was an abdominoplasty. So at this point, stop this video, hit subscribe, and then call your plastic surgeon and your insurance company and ask them questions about a panniculectomy and abdominoplasty and how we can get those qualified for you. As always, love you lots. Bye for now.